I just want to notice someone trying to get out of the room right now. Craig Jones is who provided some riveting and I would add very entertaining testimony at the Supreme Court hearing. So Craig was interviewing was representing the province of BC on the jurisdictional issue. So Craig, it's the Bowen Island's very screwed up. So Craig's whole evening is a mess. So
rush for the next one. But
thank you very much. I also have a midst full of questions, so our system did work to some extent, and everyone, I went through them very quickly, and everyone is really good, and some are really hard. So I'm going to ask our panelists to come up and sit at the table here, and I'm going to lob your questions at them. And some are directly, most questions aren't to anyone in particular, but some are. So I'm going to try, and we'll get through as many as we can. We have about half an hour, I believe. I think we're supposed to be out of here at 9 o'clock. Can someone just test one of those microphones? Is it working? Yeah, they're working. So thank you very much to the students for collecting all these questions, and thank you very much for the questions that people wrote down. And I can read most of them. I'm having trouble with some of them, but I'm going to, because Monique is on a bit of a roll, there is one question that came for Monique. And the question is, to what extent do you think a victory for Insite at the Supreme Court opens the door for Brian Day's charter challenge to the BC Medicare Protection Act?
It's kidding, man. You said they were hard questions. I don't think this is on. Oh, yes, okay. I don't know the answer to that.
She might have to do a bit of work.
Yeah, whoever asked that question, call me at my office.
Oh, okay. Put her number up on the screen in a bit. This looks like it might be, I think I'll lob this one at Will first. Could you speak a bit about the financial cost effectiveness of the program?
Sure. Those cost effectiveness studies that I was referring to, they would have been a mathematical calculation of the cost of running Insite versus the cost of dealing with overdoses, with ambulance calls, prevented cases of HIV infection, which probably cost $300,000 over the course of someone's lifetime, as well as overdose fatalities, which we can't attach a dollar figure to. So I'm not really a math person, but that's what those things are based upon, and all three of them were consistent in finding that it was more effective to operate Insite than try and deal with those other outcomes that I just mentioned.
Here's a question, not directed at anyone, but you guys can figure out who will answer it. What percentage of people using the facility are casual users looking for a safe, sterile place to use drugs that don't have any want to use the detox portion of the program?
Well, first of all, I'm just going to jump in there and casual. I've never really heard that term talking about an addict to the downtown east side. I don't think there's such a thing as casual drug use down there. Most people, we're certainly not posers. This is not about getting high on a weekend down there. This is a serious issue. It's a health issue. You know, it's issue cocaine 50 times a day to coke. So I don't think that there's really casual comes into it. I think it's a misnomer. I think we have a lot of really sick people in the downtown east side that just happen to cope with their illness through self-medication. Because, as I said before, that treatment protocol is a bunch of bullshit. It takes forever to try to get in to see anybody. They won't invest in it. They just talk about it. So I just don't think there is a lot of, it's not a party down there. Certainly not.
But are there people who, I'll say, are not hardcore, long-term, severely addicted people who use Insite?
There's a small percentage of people that use the site who may need assistance because they're not safe when they're using. And I think to differentiate, I wouldn't use the word casual either. I think the issue of addiction is never really casual, but I think some people use at different amounts and different rates and different drugs. And anybody that uses a site is actually demonstrating incredible responsibility for their behavior by choosing to learn how to inject safely, how to demonstrate responsibility for their use so that they don't spread infection. And so we really welcome that as a sort of a learning experience. So of course some people are reliant on the site for their ongoing use needs, and they come there for greater percentage of their injections than some people. But the research has shown that for everybody that uses the site, safer injecting practices are a result. So I think that that's really, really important to differentiate because everybody has different use habits. So nobody uses the same amount every day and at the same rate. So somebody who uses it like once a week may not be using 20 times a day. And that's really important to understand. But beyond that, in terms of waiting to get into the detox, all I know is there is a steady flow of people requesting access to on-site, and I don't know how the staff figure out who to get in and when. But it's amazing to me that it works as well as it does, because it seems to me that there's always about 50 to 100 people juggling on some kind of a priority list that need to, and it works. And the staff are fantastic, and I'm very proud of all the staff.
Thank you. Here's one. If the feds win, will VCH, Vancouver Coastal Health, keep Insite open, citing the Dr. Peters Center model of not requesting a Section 56 exemption? Dr. Peters Center's open.
I don't know the answer to that, but I think that we're going to have to wait and see how the court rules. There are a lot of combinations and permutations to how the result could stack up with a bunch of different reasons. So obviously for Vancouver Coastal Health Authority, they're going to have to make that decision. They have been active in this case since the BC Court of Appeal. If that's a signal, I think it's a good one.
Maxine, you want to? There's no one from Vancouver Coastal Health on the panel, so it's speculative, but it's a very good question.
Well, I guess my comment would be that from a Dr. Peters Foundation perspective, we're very firmly, clearly following provincial law. There is a Health Professions Act in this province. It authorizes and requires the College of Registered Nurses of British Columbia to set registered nursing practice. And furthermore, it says that an employer is responsible for a workplace that supports nurses and registered nurses in their practice. So the College of Psychiatric Nurses has also given us the same practice clarification. When we first got that practice clarification 9 years ago, when we went to our lawyers and asked for a legal opinion, they looked at it from a criminal prosecution perspective and from a civil prosecution perspective. And in a nutshell, they actually said to us that we were more at risk of civil liability if we didn't do it. Because if someone came into the Dr. Peters Center and the nurses refused to, if we as an employer refused to allow nurses to practice according to their standards, and someone took clean needles and went outside and injected and died of an overdose, someone could suggest in their personal world that we contributed to their death. So we'd certainly be in We did not seek a Section 56 exemption because we took the perspective we were doing everything reasonably possible to uphold federal law. The nurses do not touch the drug, like Insite, nurses do not touch the drugs, they do not inject the drugs, and they do not provide the drugs. So if, we too would have, when this decision comes down, we too will have to look at the decision if it's not in favor of Insite and kind of determine what that judgment means for us. However, we'd be hard pressed to suddenly turn around and disobey the provincial law, so to speak. So, yeah, it's going to be an interesting moment in time if the feds don't support it.
I'd like to add just for one thing, if the Canadian government the Canadian Supreme Court decides that Insite shouldn't be there anymore and rules against, there's enough drug user activism will take over at that point, and we will have Insites wherever, in apartment buildings, it'll happen. And that's what was done before Insite was open, before there was an Insite. There was a very brave nurse at one time who set up a little